Greetings everyone, Dr. Melanie Crites here with 360 Pelvic Health Institute and the Center for Men's and Women's Urology in Portland, Oregon, coming to you today with another segment. And I want to talk to you today about something that's not so much urological as much as it is a pelvic health concern. And it's bowel incontinence, or as we typically call it for technical terms, fecal incontinence. Basically what that means is a situation where you can't control your bowels. Now, as embarrassing as it is, I want you to know you're not alone. 20 million individuals in the United States alone suffer from fecal incontinence. So if you are somebody that has this, please, please, please tell your doctor about it because it is treatable. Now, what causes fecal incontinence? Well, it can be caused by constipation, it can be caused by diarrhea, it can be caused by a combination of the two. Sometimes it happens as a result of nerve injury, sometimes obstetric trauma when ladies are going through childbirth. It can be anything from pelvic trauma, surgery, all of those different things for a variety of reasons. But the good news is we do have things that can treat it. Now, if you are somebody that suffers from fecal incontinence, it's very important for you to see your doctor to find out what the source is. If it's something that is as simple as diarrhea or constipation, and I say that kind of tongue-in-cheek because when you're the one suffering with this, it's not something so simple. But from our standpoint of being a healthcare provider, if we can find out that it's caused by either just constipation or diarrhea, there are some conservative things that we can do, such as giving you dietary changes to make, or even medicines or pelvic floor physical therapy, things like that to help normalize what's going on in the gut and in the pelvis to help overcome having episodes of bowel leakage. If we can normalize the gut and the colon, or the pelvis and the pelvic muscles, if that happens to be the source, if we can normalize those things, oftentimes we can treat the problem. And once you've tried those conservative measures, and if medication doesn't work, then we can move on to other particular treatments that your doctor and you can sit down and find out which one is right for you. Now, I once saw a statistic that says 85% of individuals are afraid and embarrassed to even tell their doctors. But here's the thing. If you don't talk about it, you'll never know if there's a treatment. And I've got to tell you, it's not a normal part of aging, and you don't have to live with it. There are certainly things that we can do. I can't drive that home just fast enough, is that please, please, please talk to your healthcare provider so that we can at least get you to the right person. I personally treat fecal incontinence. I use sacral neuromodulation to do so. And I also use a combination of dietary changes and pelvic floor physical therapy. So if you happen to be one of those 20 million individuals, please talk to your doctor. I promise you we can help find a solution. And as always, I hope this helps, and thanks for letting 360 Pelvic Health help restore your confidence.